6. We're halfway through now, guys. You've had your second exam. We've already had 3 quizzes. You have 2 more quizzes left, exam and essay. So we're really over that halfway point. So we're going to be doing respiratory and cardiac today, and I'm going to do it on a Kahoots. And I'm going to try to explain it as we go. And then if we have a little bit of time after I'm done, I want to go over one question that was on the exam, but I'm going to make different numbers. So you can figure out. It was the one about doing something over 10 hours. That was the most missed question. There was another question I'll go over next week that if you listen to my review, you shouldn't have gotten it wrong, but I'll go over that next week with you all. So let's go ahead. Let's start at Kahoots. I know many of you are studying for exam, aren't looking at this information. So let's open your mind to some new concepts, trying to help you through this. Now, actually, cardiac is my absolute favorite of all of the children that I've ever worked with. The cardiac intensive care unit, I opened their unit when we got a physician from Harvard who is still there, Dr. Redmond Burke, an amazing internationally known physician. And I got for 10 years to work with him. And I love hearts. I really do. But then I went to the ER, and I like trauma too. And I got to see a lot of the other diagnoses, and that's what helps me teach you. And I did that for 10 years. You should be getting out a little bit early today with what's going on. I always say if we go straight through whatnot, we can get it done. Who else wants to come in today? Let's make it fun. Only 6 of you. Ricardo's there. Jessica's there. Karen, did you join? Angela's there.
Yeah, I'm trying. I'm trying to do it.
Okay. I see Lacey trying. Vanessa, do you want to join us too? All right, we're just going to get going. Participating in it, you pay attention more and you'll learn more. And that's why I encourage you to do that. So, acute coryza is another name for, again, this is one of your definitions. Remember, we're talking about respiratory and we're talking about cardiac this week. Coryza is simply a common cold. It's another name for it. Why coryza? They come up with these names. I don't know. I don't actually have a jingle lingo for you to remember that, but coryza, just know it's a common cold. Acute croup is also called. Well, croup is oral pharyngeal, so it's upper airway. And the other name just describes where it's located, okay? So it's in the larynx, it's swelling of the trachea and of the bronchus. So it's laryngotracheal bronchitis. Now, the thing with croup, this is the one that your child is coughing and it sounds like a seal barking. It's extremely distinctful that we know about it. Go ahead, Marn, do what you got to do. I wish you all the best. Her little boy needs her. Know that croup, if we don't take care of it, and it's just inflammation, it's usually a virus. So we usually just give steroids, decreases the swelling, and then that air that you're trying to get in gets in easier. And then, of course, that barking cough goes away. Now, if we don't treat it, the epiglottis, it could become involved. And then you're in a real medical emergency called epiglottitis. Epiglottis covers the trachea. Air can't get into the lungs. And that is extremely serious. What term is used when describing the collapse of an alveoli? Well, where is an alveoli? That's number one. So this is usually post-operatively when you're not coughing, deep breathing, getting out of bed, walking, ambulating, all of those things, using the incentive spirometry. The ends of the lungs, the alveoli, are these little open areas like little grapes, like, and this where oxygen and carbon dioxide exchange. And what happens is they collapse, and now you're becoming more hypoxic, and it's rubbing, it's creating mucus in there. So then you go into respiratory distress. So a collapse of
Professor.
an alveoli is called atelectasis. Yes.
Oh, I thought atelectasis was the collapse of a lung.
Nope, it's the alveoli. Now the whole lung doesn't collapse. That's a pneumothorax. The little pieces
Oh,
that exchange oxygen and carbon dioxide is called atelectasis. It's those little alveoli collapsing up. It could be a
oh,
couple, which don't make a big deal, but if we let it continue, not coughing, deep breathing, and ambulating, and good pulmonary care, yes, you can have more and more consolidation. And the whole lung goes, that's your pneumothorax.
wow.
Yes,
Okay,
ma'am.
thank you.
You're welcome. What is tachypnea? Whenever you see tacky in front of anything, what does that mean?
Have to do with breathing.
Oh, hi.
It's something very rapid. Tachycardia, tachypnea. Yes, yes.
Hi.
You
It's
know,
increasing, yeah.
Hello. Yeah.
knowing those initial, parts of the words and taking words and pulling them apart, you can figure it out. Like I think of pnea
Plug in a
like
cargo.
apnea. That's not breathing. So
Oh,
tachypnea is increase in
breathing.
respiration.
Version.
Yes.
Okay.
Will the nurse teach the child with cystic fibrosis to facilitate digestion of nutrients? Now, cystic fibrosis, it bothers the lungs, mucus fills up there, and also mucus fills up the small intestines, and the
Yes.
pancreas can't um, supply these things to break down fat in the body. So you a multi system problem. So it's lungs and it also has to do with nutrition.
We
So
should call the
how do
answer.
we teach them get the nutrients? Well, there's something called pancreatic enzymes which work for the pancreas. It's not working well, and it will help to try to digest. And it's usually fats that it doesn't digest. So, in cystic fibrosis, we're going to do all good pulmonary care. We're going to do chest PT. We're going to do aerosols routinely all the time to keep those lungs open. That's how much mucus is there. And then we're going to be giving pancreatic enzymes, or it's called pancreatase, before all meals and snacks. We can put it on a little food and give it. It's a powder. That stuff can irritate the teeth, so we need to rinse our mouth when we're done with that. And it helps a little bit. Now, what type of diet would a child with cystic fibrosis need? Well, they're not digesting fat. Well, what is left? Carbohydrates and protein. So you need increased carbohydrates, increased protein to get nutrition for this child. And cystic fibrosis also has salt just oozing out of the pores. The sweat is full of salt. That's why they do a sweat test to determine if they have cystic fibrosis. They just take these little tabs, put it on the skin, and measure how much salt is in there. And it's really high level. So we will never hold a salt shaker on this child. This child needs as much salt as they want to eat. When a child has a fever and an upper respiratory infection, what should be included in the nursing care? Fever, what do you worry about? Upper respiratory, all that mucus coming up, what are you worried about? Well, you're going to be giving either acetaminophen, ibuprofen, keep the fever down because you feel better when your fever is down. But also remember, when the fever's up, it's burning off all sorts of fluid, right? So you need to be giving more fluids to make up for those fluids. What happens when you have a fever and you get it down? You sweat, right? You need to replace that by giving a lot more oral, okay? And we also know extra fluid with upper respiratory thins the mucus, so it's easier to expectorate it to get it out, okay? Asthma causes what? In children, and they have asthma, what do we see? I don't know if you've had children or you had asthma or you know of, friends with children with asthma. It is one of those things that needs to be treated as soon as we see things going on. And the big thing is there's an increased school absenteeism because they get some sort of something that irritates their oral airway and they start, swelling and then the asthma occurs. It's increased hospitalizations, increased doctor's visits because, this is what's going on with asthma. Remember, asthma can be treated preventatively, but what happens if you start, your lungs get all tight and you can't breathe? Just like we
Yeah.
had status epilepticus or status, seizures, we can also have status asthma, asthmaticus. And that's where it takes a while to get that breathing started. My
Mm-hmm.
husband
I have
was
it.
there.
I'm sorry, Professor. I have asthma. Yeah.
Yep. And when you
Yeah.
can't breathe, it
Yeah.
becomes this, restless. You're fighting
Restless.
for
I'm
breath.
trying to oh, I was just going to tell you that I'm trying to hold on. I'm trying to hold my it's just so scary because you can't breathe.
My husband lived through 12 days in the ICU with status
Wow.
asthmaticus. It was, of course, I wouldn't leave him. I was there with him, of course. We got him through, though. What is the most important reason for pneumonia in infants? What is that causative reason? Pneumonia. We always think that pneumonia is always a bacteria. It's not always. They're viral and there also is bacterial. So look at this. It's the virus, respiratory syncytial virus, RSV, and we're talking infants. Now, for us, RSV is what? The common cold again, right? But in infants, suck, swallowing, and breathing, they can't. They can't take deep breaths and cough, and it does consolidate and causes pneumonia. What congenital cardiac defect causes increased pulmonary blood flow? Now, look at the heart. You have a septum in between the both right and left side, and then there's a septum between the atrium and the ventricle, right? Now, what happens if the blood from the left side, there's a hole, it can go over to the right side? Well, what area leads to the lungs? It's the right side, right? So any hole in the heart will cause there to be an increased pulmonary blood flow because it's going to go from that left side and push over to the right side. Because the right side, if you think about blood, it goes a beat, goes around the whole body, and it just gets back to the right side. So flow is very low. That left side, you've got actually four pulmonary veins putting blood back into the left side, and the pressure is high. So it goes from high pressure to low pressure, goes back into the right ventricle, and guess what? It's going to go back to the lungs. Therefore, increased pulmonary blood flow. A child swallows frequently after a tonsil adenoidectomy. What could this indicate? Remember, tonsil and adenoidectomy, They're taking the back of the throat, taking all of these nodes out. They're cutting them out, cauterizing. You're left with scabs. And we know that any irritation can cause bleeding. Now, one of the biggest symptoms is that they're just swallowing and swallowing. Well, what are they swallowing? They're bleeding, right? So they're swallowing the blood. So if you see a child after surgery with doing this, now you're not going to put anything in the mouth. You're not going to put a tongue depressor. They can open their mouth slightly and you'll probably see the mouth full of blood. And then what's the treatment? Well, we can't just stop the bleeding. You can't put your finger on it like you would anything else. Usually these children have to go back into the OR and they have to go and recauterize that area and burn the area so it stops bleeding. I've actually seen one bad case of that, and it was actually 7 days after they had it done. They had just come from the ENT and gotten a clean bill of health, and they were bleeding a lot. So, signs and symptoms of respiratory distress. What would you see? One of the things that you see in infants that's different than older children is that you're going to see nasal flaring. The nose starts to flare. The other thing in infants you would see is in really bad respiratory distress, at the end of a breath, you hear a grunt, uh, uh, and that is telling you this is a very sick child. And if you don't support that pulmonary system, this child is going to arrest on you soon. So, respiratory distress, the lungs are going to try to breathe faster. The heart's going to try to breathe faster. You might hear breath sounds that are abnormal, the wheezing, the rhonchi, the rails. And remember, if you're in distress, you're not getting oxygen. You're not getting oxygen. You're going to become confused and restless. What is an acceptable oxygen saturation for a child? Understanding what's acceptable, you can figure out, do they need us to do something, give oxygen, or do we just need to monitor this child? And then what type of oxygen? Now, all we say is above 90, and children do very well. Saturation above 90 is not a problem. They might have a cold or maybe having an asthma, a little bit of irritation. Above 90, we're okay. When it goes below, then we're going to have to give something, some sort of oxygen. A cannula would be the first thing we'd put on. The parents of a 3-month-old with cystic fibrosis want to know how their child got the disease. Neither parent has cystic fibrosis. And this analogy is actually just like sickle cell anemia. Both parents don't have to have the disease in order for a child to get it, but they both have to carry the gene. Pre-pregnancy or some of the first stuff when you become pregnant today, they send off all of this blood work, and one of them is looking at mommy and daddy, seeing if any of them are carriers of the cystic fibrosis gene. You have to have both parents in order for a child to get it.
My kid's grandmother has cystic fibrosis, so they only had to test my ex, or they only had to test me because they knew my ex was a carrier.
So, which fluids are most appropriate for a 5-year-old child with asthma experiencing dyspnea and fluid loss? And this is an important concept. Now, they need fluids. They don't just need an IV. Even with asthma, sometimes drinking is comfortable, but it's always room temperature. Cold and even cold rooms will make them breathe harder, will make their coughing more. So keeping the room in the hospital room, so it's not too cold. And then of course, not ice in their water pitchers, right? Give them just regular room temperature. How long after a smoke inhalation injury are patients at greatest risk for pulmonary edema. So could be smoke inhalation and it could be drowning also. So the lungs have had a really big shock, whether smoke stopping oxygen from going in, so a hypoxic moment, or drowning. The water's, occupied the space, hypoxic moment. And the big thing with this is it's up to 72 hours later. And why do we need to know that? Well, smoke inhalation children are admitted for at least 3 days to monitor their respiratory status. And even a child who has drowned, all right, they get the child up, they get the child breathing. Rescue comes and they're like, no, the kid's fine. Don't worry about it. No, that child will go to the ER and must be watched because it could take up to 72 hours for respiratory distress to occur. And if you don't hospitalize them, they're at home and they don't have anybody to rescue, right? They'll be on an oxygen monitor for sure. What findings are expected when measuring the blood pressure on all four extremities of a child with coarctation of the aorta? Well, let me tell you what that is. The aorta comes off the left ventricle, does a little arch, goes to the body. It's kinked. So that big hose feeding all of the body is kinked. It's narrowed. Blood can't go down. So when blood can't go down to the feet, you're going to have lower blood pressures because the blood's not there. But that extra blood is going to go upper extremities because that's the only way it can go. And you're going to have higher upper blood pressures. And usually it's about 20 millimeters of mercury difference. Coarctation, kink of the aorta, blood pressure up is higher, blood pressure lower is what you would see. What type of diet should a child with cystic fibrosis be eating? To remember, it's the pancreatase, giving enzymes to eat because they're not digesting fat. So what are you going to give this child? And remember, their skin, if you told the parent to lick it, it would be salty as salty could be. So we're going to avoid fat because what does fat cause? Abdominal swelling, gas, and it's painful. And of course, greasy stools. Now, we're going to give enough sodium, enough protein, and we're going to give carbohydrates for that also. Okay. Do you understand that? You avoid what you cannot digest that well. You'll get plenty of nutrition with carbohydrates, with protein, and then making sure they get enough sodium. Blood flow between vessels of the heart is called. So that going from the left side to the right side that I described, what is that called? We know there's increased pulmonary blood flow if it goes from the left to the right side. That's for sure. But it's called a shunt. And it always goes from the highest to the lowest pressure. So left side, because of those four pulmonary veins, there's a lot of flow on the left side. It's going to go over to the right side. So, which is less. That blood just gets back there from beating around all over the body. It is called a shunt.
I
That's
thought a
left
shunt.
to right.
I thought that a shunt was what they put in when there's a blockage.
Yes, they can. But the blood flow is also described as shunting. They put in a platelet testing shunt on the hypoplastic left heart syndromes to keep open the PDA until they're big enough. Yes, they do use shunts. You're absolutely right. But the definition of blood flow, that's also shunting from high pressure to low pressure, shunting. What is an atrial septal defect? Described a little bit, anatomy of the heart. Remember, there's septum between the whole heart and then between the upper and lower chambers. Where is an atrial septal defect? We have atrium, we have ventricles. So an atrial septal defect is a hole between the two atriums. That's the upper chambers of the heart, okay? What is a ventricular septal defect? It's an opening between the lower chambers, the ventricles there. And know that stenosis is a narrowing. There's still flow going, but it's a narrowing. Stenosis, another concept to remember. And then atresia. That means there is no opening. We usually see that with tricuspid atresia, which means that valve that connects the right atrium to the right ventricle is non-existent. A without, there's no opening, and that would be a very sick congenital heart child. Why do children with tetralogy of Fallot favor a squatting system position? Tetralogy of Fallot is that blue baby. That's those tet spells that we hear about. And it just means that the tetralogy is when the pulmonary artery all of a sudden closes off periodically and doesn't let blood go to the lungs, which stops oxygenation. And what we do is we do a knee chest on infants, which changes the pressure of that venous blood. It changes the abdominal cavity and the cardiac cavity. It changes it by either squatting, older children, or knee chest on infants. And it pops open that pulmonary valve, and it's going to let blood go back to the lungs and oxygenate that child. Which comment by the parent of a 1-month-old infant would concern the nurse about possible congenital heart defect? Well, if you're thinking about a congenital heart defect, the heart is not made correctly. So, all in all, this child's heart is trying to beat the best it can to make up for it. So, they're burning calories like crazy and they get tired crazy. They probably are not gaining weight the way that they should. And many congenital heart defects go into failure. So now they're tachypnic, they're tachycardic, they are tiring out easily. They're not gaining weight. They're burning all those calories. That's absolutely all about a 1-month-old congenital heart child. What does the nurse explain that a ventricular septal defect will allow? Which way did I tell you blood shunts in the heart? Remember that right side just got the blood back from that heartbeat. And that left side's just got a lot of pressure that's going on there. So a ventricular septal defect is going to go from the left to the right side. And when you go back to the right side, it goes back in the lungs. It's just part of what the heart, the normal way that a drop of blood would follow. It's still going to go back and reoxygenate it again. So increase pulmonary blood flow, ASD and VSD. What is a non-invasive procedure to determine if a heart is structurally normal and to find out a murmur? So children come in, to the cardiac ICU. And of course, we hook them up to a monitor, do an EKG, and then we need to find out what's going on with his heart. And it's called an echocardiogram. And we just rub on the chest and we can determine what's happening. If we find anything abnormal with an echocardiogram, that child's going to go for a cardiac cath because we need to determine exactly what's happening and plan what we're going to do to help that child. Rheumatic fever causes which inflammation? So rheumatic fever is caused by a strep infection that wasn't treated completely. It causes an inflammation of the heart, carditis. It can cause that chorea or these really different movements. You can't control the movements. And it can cause polyarthritis, and it can cause rash, sore throat, general malaise, et cetera, et cetera. Well, if it's due to a strep infection, we treat it with antibiotics. It has nothing to do with the bowel. It's the heart, movements, joints, and then the rash. Everything can be turned around except if we have heart valve damage. And this is usually the mitral valve that gets damaged. Everything else will come back with a long-term treatment of antibiotic.
Professor, polyarthritis just means arthritis
More
in
than one area.
okay.
A child recovering from rheumatic fever needs to receive monthly injections for 5 years of what medication? What did I tell you? How do we treat it? Yeah, polyarthritis means it's not just one joint, it's multiple joints will be
Gotcha.
affected. Could be hands, feet, knee, elbow, any joint it could affect. So, rheumatic fever, in order to prevent and to keep that heart from getting damaged, it is penicillin every month for 5 years. And that's a preventative prophylactic thing for it. What life-threatening illness is caused by H. influenza that causes swelling above the vocal cords? Life-threatening. I've described it already to you.
I think it's epiglottitis.
Yes, it is. Absolutely. It starts out with laryngeotracheal bronchitis croup, and then it's an H. influenza virus. It swells the epiglottis, it covers the trachea, and air can't get in. These children, they're going to have these muffled voices. They're going to be not able to swallow their own spit, and they're going to like probably leaning over trying to find a place like, where is it where I can breathe? So inspiratory, can't get air in, life-threatening. As a nurse, get somebody with an intubation tray and a tracheostomy tray and get it in that room quick, or put that child in the trauma room. That is a very, very sick child. There's no airway. That's a big deal. The nurse should prepare for emergency intubation when caring for a child with what diagnosis? Many times they can't even do a regular intubation with an endotracheal tube. Usually, what happens is they have to do an emergency tracheostomy, which is the swelling below what's going on. It is epiglottitis. Because remember, there's no airway. They can't breathe. Yes, many a times we'll give, racemic epi aerosols, and we'll give albuterol aerosols. We'll start an IV, give steroids, but still they can't get oxygen. You need to be prepared at all times to do an intubation, whether an endotracheal tube, which usually it doesn't work, they're going to do a tracheostomy right there at the bedside. Save a life, for real. How do you treat primary hypertension in a child? Years ago, we didn't check blood pressures on younger kids. Below the age of 5, we didn't. But we have found there's actually children with high blood pressure at a lower age, younger children. So how do you treat that younger child? Let's place them on medication right away? No, that's not the answer. Number one, get them up, get them active, make their body more in tune with exercise, okay? Also, DASH diet, where you're just decreasing the fat and salt in their diet, so it's diet and activity is what they need. Good job, guys. What congenital heart defect is diagnosed with an aortogram? What did I tell you, the aorta, the one that kinked? What's the name of that one? That's, they put dye into the aorta and they see it fill up, and they can see where the narrowing is or how big that narrowing is. And then they know how to treat that child. And it's called coarctation of the aorta. Aortic stenosis is the valve in the left ventricle that opens up and lets blood flow out the aorta to the body. And it's narrowed. That's all it is. It does not diagnose the aortic stenosis. Coarctation is that big thing. They put dye in and they can actually see the kink in the aorta and where it is in that aorta. It's on the arch. Is it by those three veins, the subclavian, the carotid arteries? Is it up there or is it lower? Very important to know where it is. Early signs of congestive heart failure. This is a child whose heart's not working that well, whether it's a congenital heart defect that now is putting fluids up into the lungs, which is congestive heart failure. What are you going to see? Well, you're collecting fluids. One of the big telltale signs is a weight gain. And 3/4 of a pound in one day is a lot in a child. So that's to be looked at. Also, again, the dyspnea, tired when feeding, or any activity, tired's easy, something's going on. We know they're not oxygenating. And tachycardia while they're asleep, which means it should be normal, but the heart's still trying to work hard. So yes, all of these, very good. What is the difference between HDL and LDL? Do you know how I remember this? HDL is healthy cholesterol, and LDL is lousy cholesterol. What do we want? The healthy or the lousy, right? So it reduces the buildup, the HDL, and the LDL is the one that gives you the risk. Very good. Hyperlipidemia is and again, this is something that years ago in young children, we didn't measure this. But we found out again, there are children, familiar histories, etc., that are more apt to have too much fat, too much cholesterol in their body. And again, we treat it just with diet. We don't like to put any child on medicine first and treat it with diet. That's what we're going to do. But hyperlipidemia is too much fat, fat-like substances. And last question. A hypoplastic left heart syndrome involves the underdevelopment of what? This is probably the most severe of all the congenital heart defects. These parents are usually the nicest, sweetest parents there are, and we learn to love these children. When you say hypoplastic, which means the muscle is thick, doesn't work. And that left ventricle, the pumping of the heart, is not pumping blood around the way it should. This is the one that you're going to put that BT shunt, that platelet tussock shunt on. Keep the blood going from the lungs to the body until we can do even other sort of surgeries. There's 3-stage surgeries on these children. It is a lifelong commitment on these parents and the child. Okay, Carr, good job. Number 2, Miss Houston, good job. Number 1, Jekka, yes, Jekka, good job. And the Sib and Amila. So again, we're going to be doing.
Professor, excuse me, that was
sure.
Karen.
As in, good job, Karen. I like that. So anyway, remember,